States are slowly reopening after the coronavirus pandemic shut down businesses across the country, and experts have been telling us this will cause more people to get sick with COVID-19. The founder and CEO of Ms. Medicine, Dr. Lisa Larkin, is here to answer some questions about what's ahead. Lisa, I want to talk to you about something I've been wondering about. There's been all this debate about masks. I would like for you to help us with how to use them. What kind of behavior should we be doing when we're wearing a mask? What if you go to a restaurant? Tell me your thoughts on that as a doctor.
Right. So this is really hard, and it's hard for me as well. First of all, the masks in the state of Ohio per Governor DeWine are not mandated, but I would really encourage everyone to wear a mask when you are in public situation, because again, what we know now is not a lot of us have been infected, that the virus is still here, that we can still shed the virus, and each of us should be doing our part to prevent transmission, and that includes wearing a mask. Now again, it can be a homemade mask of tight material. I actually have several that were given to me, which are quite lovely. It can be a regular surgical mask. They need to be covering your nose and your mouth, and they need to be relatively fitted. Again, one of the big things really is to wear the mask, but when you're touching things, you don't want to touch your face, right? So again, it's about not touching your face with your hands and about hand washing. So again, wear your mask, but again, be careful with touching your face, and hand washing is still really, really important.
Okay. And as things start to reopen, like the restaurants, the gym, the hair salon, I want to go shopping, what other things do we need to be doing to keep ourselves safe and healthy?
Right. Well, first of all, I'm right there with everybody else in that I'm desperate for things to open, right? I think we're all really tired of this. But again, we can't let our guard down, and we can't completely go back to normal. So the key thing again is hand washing, hand washing, hand washing. And again, that social distancing, really keeping 6 feet away in all of those circumstances that you can, and wearing a mask when you're in public situations. Now, obviously at a restaurant, you're really not going to be able to eat with a mask on. I don't know truthfully exactly how that's going to go. I know the capacity at restaurants will be decreased to allow for more social distancing, but that's really hard. And certainly at a gym as well. When you're exercising on equipment, I'm not exactly sure how comfortable wearing a mask is going to be, but I encourage people to do it. And again, it's all about hand washing and wiping down the equipment and washing your hands before and after you go into the gym.
What about vacations or trips? Summer's almost here. Is it okay to plan things like that?
Right. I will tell you, this is a question I'm asking myself, and certainly I hear from patients time and time again. It's really a tough discussion to have, right? Certainly, I think that airplane travel is a concern, even though I know the airlines are doing a great job to try to space passengers out, leaving the middle seats free, leaving rows free to decrease capacity on planes. Patients are being asked to wear masks. I think that certainly will help. But again, I do think planes are closed environments, and that is a risk factor for sure for transmission. If you can drive on vacations, that's probably better, but I would caution everyone to just think about where you're going and what you're going to be doing on vacation, right? So if you're going to visit elderly relatives who are in that high risk category, I would really be thoughtful about that. In my own personal situation, again, I'm debating this with my husband and family, whether or not we can plan a vacation this summer. But certainly when it comes to older parents and relatives, I'm being very, very cautious, because those are the people who are at the absolute highest risk.
And that leads to my next question, just real quickly. Should older people and people with other conditions still stay home?
I really tell you, that's the group that really should be even more cautious. So as we're reopening, I really think it has to be structured for those who are healthier and younger to be able to take those first steps. And it really is the older individuals who have those associated medical conditions who really should be working harder to stay home as much as possible.
All right. Dr. Lisa Larkin, thank you so much for your wisdom and your time.
Thank you, Sheila, as always.